Okay, thank you. Now, third item in the name of Deputy Colm Keaveney. Again to the Minister for Health, the overcrowding crisis in Emergency Department. 4 minutes.
Thank you, Keaveney. Minister, today there are nearly 500 people lying on trolleys in our public hospitals, and within that, the worst public hospitals today were Beaumont, where 45 people remained on trolleys seeking help and support, and in my own county of Galway, between GUH and Portiuncula, 36 patients waited for treatment on a trolley. And Minister, to say that this is becoming commonplace in terms of it occurring week upon week, it's a complete understatement, because we have a situation where today 480 people to 500 people on trolleys seeking help and support in our public hospitals is hardly making the news. And Minister, I'm sure you will agree that it will take matters such as that of last week, where we heard the testimony of the Keaveney family with respect to their family member who waited for support and treatment in Beaumont, and it took the testimony of that family to garner the support of the public to raise questions again about how we approach the overcrowding in our accident and emergency units. And Minister, you say that you have been in touch with the chair of Beaumont about the Jerry Feeney situation, and you said last week that indeed you were disappointed and that you were waiting for the outcome of that investigation into the scandalous treatment that the Feeney family received with respect to Jerry Feeney's concerns. And they said last week in their testimony that there was no dignity in terms of the support that Jerry Feeney had while he was a patient in Beaumont Hospital. And that's the case for an 81-year-old man who was suffering from Parkinson's disease, who died on the 31st of January, 3 weeks after being discharged from the Beaumont Hospital, that he was there lying in a soiled state. And his family said, I quote, "He was being treated as if he was invisible." Minister, I don't doubt you are disappointed, and I'm sure that your disappointment goes some distance to demonstrate your concern and your recognition of the Feeney family's concerns. But Minister, how long is this going to go on? Minister, how many more Jerry Feeneys is it going to take before we start getting real in this country with respect to the sense of urgency that's required to address this ongoing situation? Because, Minister, there's no doubt that people are tired hearing that it has to get worse before it gets better. And, Minister, you're not going to get away with dragging this on into a general election into 2016. It will have to get better now, Minister. I'm asking you to intervene in a human way with respect to what is going on in Beaumont Hospital today, where 45 people are struggling to have attention on trolleys. It's completely unacceptable. And Minister, don't think that I'm trying to score a political point here with you today. And I know what you said with respect to your last contribution, that you're not going to comment. I'm asking you to act and to lead on this situation. Minister, can I ask specifically, did the HSE seek €106 million last year to address this crisis? Would you make a comment with respect to that in your response? Minister, since Christmas passed, has the HSE shared with you any interim assessment on how much monies, how much resources are required to address this crisis? Minister, has the HSE at any point advised you that they require €130 million or €100 million, or somewhere within that reference of resources? And was that required by the HSE to deal with this crisis? And finally, in my last 10 seconds, Minister, the €25 million announced by you in the service plan, has it all been spent? How much of the €25 million that was specifically announced to address this crisis, how much of that resource is left?
Thanks,
Thank you.
No, Minister.
Yeah, the Deputy may well believe that he's not trying to make political capital out of a particular issue here, but you know, the issue that you asked to raise here is the issue of the overcrowding crisis in emergency departments, which is compromising patient dignity. What you went on to do was to raise a specific issue about a specific individual in a specific hospital whose complaint relates to the poor care they received on a specialist geriatric ward, not actually in an emergency department. But I have been in touch with with the chairman of Beaumont about that matter, because it is an issue of public concern, and it's always an issue of concern to me when I hear of complaints about how people are treated on wards in our hospitals or in emergency departments, as the case may be. Even though the vast majority of people who do speak to me tell me they have a very good experience of our hospitals once they get access to those hospitals. I am informed by the chairman of Beaumont Hospital that the individual case is being investigated, and also there's a wider review of how elderly people are treated in that hospital by that hospital. I should point out that Beaumont is a voluntary hospital and is not a HSE hospital. Has its own chairman and board. I think it's important that that is understood. In relation to the issue which the Deputy raises, or at least gave us notice that he was raising, I do want to acknowledge the difficulties which the current surge in ED activity is causing for patients, their families and the staff who are doing their utmost to provide safe quality care in a very challenging circumstance. As of 2 p.m. today, the number of people in trolleys had fallen to 306, with 214 on trolleys for more than 9 hours. This ranged from 1 in Keaveney and Kilkenny to 32 in Beaumont, where more than 28 were on trolleys for more than 9 hours. In Portiuncula, for the Deputy information, the numbers were 3, with 2 over 9 hours. And while the numbers have come down throughout the day, they do remain extremely high. It must be acknowledged that through the hard work of hospitals working together, supported by other HSE services, HSE management and my department, we've significantly reduced the numbers experienced, which peaked on the 6th of January. All hospitals have escalation plans to manage not only patient flow, but also patient safety in a responsive, controlled and planned way that supports and ensures the delivery of optimum patient care. Triage is operated to prioritise patients so that those with most acute needs are seen and treated as soon as possible. The Government has provided additional funding of 3 million in 2014 and 25 million in 2012, or 2015 rather, to address delayed discharges. And HSE is accessing all suitable non-acute accommodation to the maximum extent possible to allow those who have been clinically discharged to leave acute hospitals. Actions currently being undertaken to address ED overcrowding include the provision of 900 additional transitional care beds in nursing homes, 500 in January and an additional 400 in February. 173 short-stay public beds are being opened across the country for a 3-month period at present, but there have been difficulties in staffing those, although we continue to try to do so. Up to 300 overflow beds have also been opened in acute hospitals. There have been 400 additional home care packages, 300 additional fair deal places, and an extension to the community intervention teams. So I think anyone who opposite thinks that I'm only interested in engaging in commentary and analysis can see that it's possible to take action as well as engage in commentary and analysis. It's not a mutually exclusive thing. The HSE has the capacity to recruit where it needs additional staff, and arrangements are being in place in the HSE to allow the recruitment of such staff where it's been established that there is an urgent service requirement. And this year the number of nurses directly employed by the Public Health Service will increase by at least 500. In addition to that, there will be additional mental health nurses as well. You'll be aware that I convened the Emergency Department Task Force to find long-term solutions to overcrowding by providing additional focus and momentum in dealing with the challenges presented by the current trolley waits. This is made up of relevant stakeholders, including senior doctors, lead hospital consultants, GPs, HSE national directors, union reps, senior officials for my department and the HSE. The HSE is currently finalising an action plan under the auspices of the ED Task Force with the view to delivering a significant reduction in trolley waits throughout the course of 2015. I'm determined that the action plan is completed as soon as possible, taking the views of the task force into account and then operationalised without delay. The task force is due to meet again on the 9th of March. I want to reassure all members present that we're working hard to find workable solutions to the management of emergency care, with optimum patient care and patient safety at all times remaining government priority.
Now, Deputy Keaveney.
Thanks, Kerry. Welcome the Minister's response, in particular the confirmation that you will recruit additional staff in mental health. I want to acknowledge that, considering that you're operating with 1,000 less staff than you were at 2011. There's 1,000 less support, caring, and the whole plethora of staff that are required in the mental health service to deliver the vision for change. Minister, has the HSE advised you that they require more money, somewhere within the region of 100 to 130 million euro, with respect to the action plan? Have you costed the action plan involved in the statement? You say that the actions being taken would provide for 900 additional transitional care beds within nursing homes, that you would have 173 short stay beds, and that you are looking at 300 overflow beds and an additional 300 in the Fair Deal scheme. What is the cost of that? And have you spent the €25 million that was provided for in 2015? Is that satisfactory, or will you need more in order to provide for the action plan?
Thanks.
The 25 million isn't all spent, but it's all fully employed. Once you provide an additional 300 Fair Deal spaces, and once you provide an additional 400 home care packages, they don't get turned off at a certain point. They have to be funded throughout the whole year. So the 25 million is not all spent, but it will all be spent because we're not going to take away those Fair Deal spaces or those additional home care packages during the year. So I'm not sure if that's clear, but the money is not all spent, but it is all committed. So any additionality would cost more. Additional Fair Deal spaces would cost more, for example. As I confirmed quite a number of weeks ago, when the HSE put in its bid for 2015, it requests an additional 1.4 billion to solve pretty much all our problems in the health service. If you believe that money alone can solve all our problems in our health service, I imagine other agencies like the NRA or the Department of Education or you name it also put in very high figures as to what they would like to get. And what ministers then do is try to secure as much as they can. And what I did manage to secure was a supplementary of 680 million, and on top of that, the first increase in 7 years in the budget, after 4 years of cuts under your party and 3 years of a budget freeze under this government. But it is undeniable that we're struggling. Of course we are. We still spend 1.5 billion less than we did 7 years ago. We have 15,000 fewer staff, and there aren't less patients. There are more patients, and they're older, and they have more demands. So of course we're struggling. But I can absolutely assure you that everyone in the Department of Health, including the ministers, everyone in the HSE, and everyone working in the health service is doing everything they can with limited time and resources to alleviate this situation.
Thanks, Minister. Now,